Hello, this is Colleen Parsons with Musculoskeletal System Part 1. Please review your anatomy. We'll go over it. We'll touch on it quickly here. As for your skills check, this is not a difficult one. Do the introduction, and then you are asking, as part of the exam, to assess their ADLs. And what you're doing when you're assessing the ADLs is asking the patient questions like, you're looking for large motor movement, stability, and fine motor movement. So can you button your clothes? Can you dress yourself? So what you would say is, do you have any difficulty getting dressed in the morning? Do you have any difficulty showering or bathing? Do you have any difficulty making your food? Those sorts of questions will give you an idea of what's going on for the patient. You can also ask, do you have any difficulty going to the grocery store? The answer will tell you a lot of information. So consider questions like that. Assess your gait. You want to ask them to walk back and forth, or perhaps you've already seen them walk back and forth before you started the interview. You want to move their neck through the range of motion. Can they move their neck? Is there any pain or difficulty when they're doing that? You're going to check for the head strength. Debbie probably shows you that in her videos. You're going to palpate the cervical, spine, and neck muscles. Then you're going to actually look at their back for structural changes in the spine. Palpate the spinal column. And you're going to inspect all joints for enlargement or deformity. You really want to feel these joints. So while you're palpating all of the muscles throughout the body, you're going to spend a little bit more time on those joints, making sure there is no stiffness, that they are not swollen, and there's no heat in those joints. You are going to ask the patient to move 2 major joints through ranges of motion, and you're going to name what those ranges of motion are. You're going to test muscle strength, upper and lower. So test the arms and the lower legs. Those are the 2 easiest. And then you're going to compare the length of the arm for the patients and the length of the leg. And then your ISBAR, and you're done. So you can go through your physical examination in your Jarvis text. Look in there for some hints about how to do things. And they have some great videos in there, again, online. You really want to focus on all of your joints. You can see that we've already done this before. Those of you who just want to listen to the slides, this is one of the slides that I actually have. A couple years ago, when my daughter we didn't know when she was going to go into labor, I did voiceovers on each of the individual slides. Here's where the synovial fluid is, and in the knee that can become quite filled with fluid from time to time, and that can create a lot of pain and difficulty for the patient. So as you see, I'm just skipping through these. All humans only have 7 vertebrae, or not humans, yes, that's true. All humans have 7 cervical vertebrae, but all mammals, even giraffes, have the same number of vertebrae as a mouse. shoulder, elbow, wrist, and carpals. Bones of the hand. I don't know why that's bones of the hand. That's not bones of the hand. And hips. And knees. Ankle and foot. So all of those key joints. Developmental competence in children. We've talked about this already a little bit. They grow differently sometimes, but their height will generally cease. With women, it's about 14 to 16, and they might grow a little bit taller after that, some women. And men usually will stop growing about 2021. Posture changes in pregnant women, and they get lordosis, where there's that curvature in the back. Also, obese people get that. So when there's a heaviness in the front, the back, the spine will shift in order to keep the person balanced. So that's lordosis. Kyphosis occurs in aging people, where you get that slight hunchback appearance. And the muscles become weaker and weaker as someone ages. And that's the end of part 1.